The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hello, everyone. This is Jonathan Marks from Go to Health Media. Welcome back to another show. You can listen to us on 8 podcast networks and watch us on YouTube and our website at gotohealthmedia.com. We encourage you to subscribe so you never miss one of our helpful, information-packed shows. There are tremendous changes happening in healthcare under the new presidential administration and guided by Project 2025 from the conservative think tank, the Heritage Foundation. In previous shows, we covered how Project 2025 will change healthcare in the United States. You can see those presentations when you visit our website at gotohealthmedia.com and click the tab that says Project 2025. I will be updating you on changes in healthcare under the new administration with evidence-based information from time to time. Today, I want to talk about DEI and its critical importance in healthcare. So there are current challenges to DEI. Under the current presidential administration, the term DEI is now out of favor. Diversity, equity, and inclusion is now seen as a threat to majority populations, when in fact the purpose of DEI is simply to provide equal opportunities to people from all walks of life based upon documented prejudices and disadvantages against minority populations. Inaccurate and unfair claims are made that DEI's purpose is to bring unqualified people into particular positions based on their backgrounds rather than their qualifications. Corporations have eliminated their DEI programs to please the new administration. Yet I want to argue that diversity, equity, and inclusion are critically important in healthcare. Just as voices have been raised which have reversed announced policies on tariffs, Gaza, the U.S. Postal Service, USAID, I am advocating that voices be raised to reverse the new trend in eliminating DEI in healthcare. Those who are advocating for the disbandment of DEI programs do not understand the ramifications this means for maintaining and improving the quality of healthcare in the United States. Why do I say this? Let's take this piece by piece. Let's start with diversity. Diversity represents and appreciates the differences among individuals who are patients, including race, ethnicity, gender, sexual orientation, socioeconomic status, and disability. This means that any patient wants to be treated equally with anyone else and with the best medical care available. How would you feel if you as a patient was not getting the care you were satisfied with because of who you are? That wouldn't feel good, and it wouldn't feel good to anyone. In order to accommodate diversity, we need 2 capabilities within the healthcare system. First, we need healthcare staff trained to recognize and deal with patients from diverse backgrounds, with sensitivity to working with patients coming from different approaches to disease and healthcare. Let me offer 2 examples. A doctor walks into an examination room wearing a mask over her nose and mouth. The patient, recently from Africa, who's not feeling well, freaks out at the sight of the doctor's mask. When the doctor asks what is wrong, the patient says, "In my country, when a doctor wears a mask, it means I have a fatal disease the doctor does not want to be exposed to." The doctor calmly explains she's getting over a cold and didn't want to spread her germs. Simple understanding, curiosity, and reassurance is what is required by the doctor in this case. Let's take a second example. A Hispanic patient has diabetes and is overweight. The doctor is trying to get the patient to lose weight to improve his health. The challenge is that in some poorer Hispanic cultures, food is expensive or in short supply. Acquiring food to feed a family is an important endeavor. In these cultures, being overweight is a sign of good nutrition and good health. So we need sensitivity among health professionals as to the diverse beliefs and practices of their patients. Diversity also ensures that the healthcare workforce reflects the diversity of the patient population. When you go to a clinic or hospital, it's natural to feel more comfortable when you recognize staff members who represent your ethnicity or background. Let's talk next about equity. Equity ensures providing fair and just treatment to all patients regardless of their background or circumstances. There is plenty of data that suggests that not all patients have been treated equally or fairly in the past. A prime example is women. There are many health conditions among women which are different from men, and the knowledge of medical staff has in the past not been up to date or unbiased about women's issues. These biases can be magnified in the relationship between a doctor and patient when it comes to differences in gender, race, ethnicity, gender identity, to name a few examples. So equity addresses systemic barriers that may prevent certain groups from accessing healthcare, such as language barriers, cultural misunderstandings, financial limitations, and even where you live. And finally, let's discuss inclusion. Inclusion creates a sense of belonging and acceptance for all patients and healthcare professionals and ensures that everyone feels heard, respected, and empowered to participate in their healthcare decisions. Lack of inclusion can discourage patients from seeking care at the right time. This leads to higher rates of healthcare emergencies and costlier expenses in the provisioning of healthcare. So, what are the benefits of DEI in healthcare? Studies have shown that DEI in healthcare leads to better health outcomes for patients from diverse backgrounds. For example, when we consider heart health, heart disease is the leading cause of death in the United States. But did you know that in clinical trials, both women and minorities are underrepresented, which means that women and minorities are not addressed in the formulation of new medications and healthcare practices? By addressing equity issues, DEI can narrow the gap in healthcare outcomes among different populations. Equity also assures increased workforce satisfaction. A diverse and inclusive workforce is more likely to be engaged and satisfied with their jobs. And that's so important to each of us as patients receiving care from a variety of healthcare staff who we want to be motivated to provide us with the best care. DEI fosters a culture of collaboration and creativity, which can lead to enhanced innovation and advancements in healthcare. So, implementing DEI in healthcare includes the following benefits. Development and implementation of DEI policies and procedures assure fair and competent and top-rated healthcare to each of us, no matter who we are. How would you feel being treated less than the best based on your religion, the color of your skin, the disease you're suffering, or the improvements you want to make in your own health? Recruitment and retention of a diverse workforce provides staffing that represents the populations they serve. DEI also encourages partnering with community organizations to reach underserved populations. And finally, DEI includes collecting data to track progress and identify areas for improvement in diversity, equity, and inclusion. And speaking of data, did you know that a significant number of databases on government health websites have been deleted? This has been done to stop communications from the NIH, the National Institutes of Health, and the U.S. Centers for Disease Control, the CDC. These data serve to provide the best and evidence-based healthcare coverage to all individuals, regardless of who they are or what conditions they have. This will be the topic of another show in the near future. So in conclusion, DEI is essential for creating a healthcare system that is equitable, inclusive, and patient-centered. By embracing diversity, promoting equity, and fostering inclusion, healthcare organizations can improve the health and well-being of all individuals throughout the United States. Raise your voice to assure fair and equal treatment for all patients who need our help. Let's reverse the steps that are being taken by the federal government and healthcare, handled so inconsiderately by bureaucrats who do not know or care to understand the ramifications of the long-held policies which makes the United States the top-rate country we are. This has been Jonathan Marks for Go to Health Media. Thank you so much for being with us. Thank you for listening. We appreciate your listenership and your subscribership. And as we say at the end of every show, remember, go to health. Take care. We'll see you again next time. Bye-bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.